Hi, my name is Michael Mendez, and today I will be presenting to you case study number one. It is about a 30-year-old man who had an above elbow amputation for reasons that he did not disclose. He described he was experiencing phantom limb pain, which is basically a neurological condition in which, in the absent arm, he will feel cramping and electric pain. He will describe it as it occurring quite frequently, and he will describe the pain as an 8 to 10 on the VA scale. For those of you who don't know, it is a pain or discomfort measurement. The patient would try various methods in order to relieve himself of this pain, such as pharmaceutical treatments. He would be prescribed oxycodone and amitriptyline, which are pain medications that specifically work to help people when they're feeling nerve pain. He also tries spinal cord stimulation, which basically it's pacemakers being placed underneath the skin in order to shock the spinal cord, and it's supposed to disrupt those pain signals. It was quite inefficient. The patient would not have seen a decrease in pain until he tried out mirror therapy. Mirror therapy is, as shown in this photo, is basically there's the absent and the unabsent arm. The unabsent limb, we can say, is placed on the side with the mirror, while the other side is either cover or hiding behind the mirror. What this is basically supposed to do is trick the mind into believing that the absent arm still remains, because we're using visual feedback to basically trick our mind into believing that the arm is still there. Because what's essentially happening is that our minds are using, because our mind uses mirror neurons to differentiate between left and right. Thus, when we see a part of our limb that's just missing, we're given like this amount of sensory feedback that we should be feeling pain, we should be feeling some sort of discomfort because something is missing. But because we're using that illusion, that visual illusion that our arm is still there, basically tell our mirror neurons that, like, no, it's still there, we're okay, we shouldn't be feeling pain. This is possible because mirror neurons are able to reorganize in the hemispheres, and yeah. But this is not to say that this is like the be-all end-all solutions, because the patient would say his pain would decrease only from an 8 to 10 to a 4, but it would still be a 4. So his pain did not completely go away, but it should not be denied how effective mirror therapy is.